February 13th, 2024. My name's David Knox, and I have multiple system atrophy. Won't lie to you, I have not been on it for a while. I've been feeling a little down on making videos or being in public in general. Long story short, two of my 5 or 6 friends that were a part of a msa coalition Zoom group that I attended for the most part every 2 weeks, suddenly passed away unexpectedly overnight. And the reason probably is breathing disorders. That's the going theory, which kind of hit me hard because I had a couple tests done, which also points to the same issues going on right now. So normally people with MSA have issues breathing issues within 5 years, major breathing issues. And here I am just starting the third year, and I seem to have a conundrum of issues coming down on me all at once. So that's one thing I want to talk about. I want to say to preface this is that it's key to see a movement disorder specialist if you think you have any type of neurological disorder, right? Neurologists are great for what they do, but they're not specialists in any certain field except neurology. I mean, there's many subsets in neurology which they don't practice on a day-to-day basis. So you might walk into MSA and they have no idea what they're looking at, right? It doesn't make them wrong or bad or anything. It's just that's the way it is in life, as we spoke about before. So I finally completed the barium test, the barium swelling test, and then I also had at the same time, I went down to my movement disorder specialist to keep up with her because I really enjoy her. She's very knowledgeable and she's on point. And even before she saw me, before I even walked into the office, she had randomly, without warning, ordered a breathing test. I didn't know about that. She didn't see me, so it's not like she saw me like huffing and puffing. She ordered a breathing test probably because she knows, as a movement disorder specialist, the rate of progression of breathing problems in patients with MSA. And she orders it, and here I am failing a breathing test markedly, right? Not by a little bit, but by a lot. So on top of the swelling test, I also want to talk about the breathing test. And I think the simplest one to start off with would be the breathing test. And it's very simple machinery to use in the clinic, in the office. And I showed a picture up here. It's never good when a doctor is highlighting or drawing arrows or like circling, like, hey, look at this, never good. And it's a coincidence because my movement disorder specialist and my local neurologist, they all work together. But I mean, I don't see them talking on the phone, but they communicate, because as soon as I got these 2 tests back almost within the same day, I'm scheduled for a minor surgery, which tells you something's going on. So the top couple columns there, 83, 78, I'm in the top, right around 80% percentile of my age and, gender for breathing. That's great. But why not 100? They want us to be 95 to 100, right? Over 90 would be great, but 78, why so low? It's still within acceptable standards, as they say. It's not major, it's nothing major, but apparently it is. If we scroll down to on the very far right column, the percent of predicted value, the bottom 2 that have values 42 and 60 is the PEF and the FEF. And it took me a second to figure out what these things were. So the PEF, which is let me get it here for you. The PEF test is peak flow, right? So what that does is it measures, I'm looking over at the screen so I can read it properly for you. The peak flow test measures the flow out of the lungs, also known as peak expiratory flow rate. And you can see over there the numbers, 240, the best I had was 243.9. And for adult males, this is supposed to be 320 to 470. So at that point, I'm only in the 42nd percentile, which being 42% is a fail in school. So it can't be good no matter what. So apparently I'm breathing in okay, but expelling my air, I'm not. I am severely behind. And literally everywhere I read on every website, it says that if your peak flow reading is less than 50% of your normal rate, which mine is 42, Well, you can see the 580, right? So 580, take that in half, that would be 240. I'm at 243. They consider that a medical emergency. I'm sure they're like, hey, we can wait until we get some other tests done, but that's not great, okay? And the other one, the 60, which is on the screen, is FEF. If I go back and click on it, FEF stands for forced mid-expiratory flow. It is, quote unquote, potentially the most sensitive marker of obstructive peripheral airflow, COPD. One of the major causes, if not the most deadly symptoms of effects of MSA, is breathing problems. And that test saying, hey, in the 60 percentile, it's an early indicator for those that are going to have COPD or major breathing disorders. And yet here we are. I had, on top of the other test I had, he does have major breathing disorders, because not only the swallow test, but then they did the breathing test, but also the swallow test I had done, the barium one. So if that one, as you see, it says it right there, right? It says, at the very bottom, right, it says there's a fusion of the C2, C3 vertebrae, which I got, no problem with that. It says that I have a normal swallowing mechanism, no esophageal diverticulum. They look up that word. Esophagus is patent and reveals an element of intra-esophagus reflux. I kept trying to look up what patent was in an esophagus, and I can't get those two together, so I looked up patent medically, and patent medically means open. Now, obviously, the esophagus is supposed to open up, but it's not supposed to stay open 100%, right? That's breathing and eating. It's two separate things. Then it also says this might be an element of the esophagus reflux, intra. So that is where the condition where the stomach acid leaks into the esophagus, usually caused by weakening of muscle at the bottom of the esophagus. Okay. Just yesterday, I swear I about died at 7 o'clock in the morning because I woke up and I could not breathe. This wasn't the esophagitis, the spasm. This happens ever so often, usually at nighttime, but never has it ever happened early in the morning, 6, 7, 8 o'clock. And what it feels like is where my contents of my stomach have came completely up into my throat, stayed there, and got into my lungs. And now, I like to my wife, I spent the next hour or two trying to cough up stuff, literally from my lungs all morning long, vomit for all intents and purposes, to get normal breathing. And that's a huge cause of death in people with MSA is that what we call aspirated pneumonia. You get something in your lungs where you're not supposed to have, it stays there and causes pneumonia, and we die, which is crazy concerning, because that spasms and not swallowing and breathing happens daily. But that one I just spoke about, waking up and gasping for air, I'm surprised my daughter didn't wake up, spasming for air like I was dying. You know, you heard me, it was like, I'm talking like gasping for life itself. To see that coming on strong now, it does not make me feel better. It goes on to speak about longitudinal thickening of the esophagus. There appears to be longitudinal fold thickening, which may represent an element of esophagitis. So fold thickening is defined as folds that are more than 3 millimeters wide. Longitudinal folds are temporary structures that appear when the esophagus collapses. Okay, like this sounds bad. And then the second part of that is the element of esophagitis. Well, esophagitis is the inflammation of the esophagus. The esophagus is the muscular tube that delivers food from your mouth to your stomach. Esophagitis can cause pain, difficulty swallowing, chest pain. Many different things can cause it. So we'll just stop at that because there's a whole list. When your esophagus collapses, great. It doesn't sound good, right? At the very end of this, it speaks about there is a small sliding type hiatal hernia, right? A sliding hiatal hernia, as defined by the websites, also known as a type 1 hiatal hernia, is the most common type of hiatal hernia, accounting for more than 95% of all cases. In a sliding hiatal hernia that I have, the stomach and lower part of the esophagus slide up into the chest through the diaphragm. Sliding hiatal hernias impair the clearance in the distal esophagus by a phenomenon called reflux. That's reflux. It occurs predominantly during inspiration and is most pronounced in the recumbent position. So apparently the breathing might be attributed to, if not partly, to the swallow test. And it was such importance that I have a procedure tomorrow where I will be under full anesthesia. They say at least 3 to 5 hours anesthesia to do this scoping test where they blow up the throat and they have the scope that can literally do anything and everything, take out A to Z, like fix things. It's to repair the throat, esophagus. So apparently it's not life and death emergency, like, hey, go right now, but they schedule that immediately. So, because I have problems with breathing and swallowing. I mean, I'm not going to say these things are life and death, but as I said, I believe in one of my last videos, is that the breathing and swallowing issues are coming on strong, right? I mean, everything else is too, but not everything is coming on strong and hitting hard, and making you worry. But the swallowing and breathing stuff is for me. It absolutely is. Eating food on a daily basis is I'm choking all day long and swallowing. My wife said, everyone will say that this guy has such labored breathing. I'm not out of shape. Granted, I don't exercise really anymore, but why is this guy breathing like he is? Well, he's breathing in fine. He just can't get it out. I mean, it makes you feel tired. It's a cascading effect. It makes you feel tired, blood oxygen levels, things like that. So, I have that appointment tomorrow with the surgeons, and, MSA people, anesthesia, we're not supposed to go together. And not that I'm concerned or worried about it a lot. It is in the back of my mind because I just had 2 good friends that passed away suddenly, without notice, without no tracheotomies, nothing on their throat, nothing for breathing were they given. Died overnight they just simply stopped breathing. And here I am yesterday at 7 a.m. gasping for my life because I stopped breathing in the worst way, not the typical way of, I'd say for the last 10, 15 seconds. This one was longer than that. So, I thought it was very interesting to share this. It's not every day you know how long you're going to live and what you're going to die from. But if you have multiple system atrophy, breathing problems is more than likely the way we're going to go. We're going to pass in this life. And here we are with 2 issues, breathing and swallowing at the same time. So, I thought this was very informative, something I wanted to share, especially the day before I go in for the surgery. I'm going to post this today, the same day as recording. And then I'll let you guys know tomorrow, put at least a post on my Facebook, how things went, on my YouTube. And then the next day, very early, like 3 or 4 o'clock in the morning, we got to get out to Mexico because we have a very sick family member who's battling pancreatic cancer. So we want to go check up on her. But again, I appreciate you. Love you to death. I believe today is today or tomorrow. I think today or tomorrow starts the MSA support for donations given through Krispy Kreme donuts. If you buy a dozen online through charitable donations, you buy a dozen for $14-15, and 50% of those donations go straight to the MSA research funds. So, not that every day I encourage people to eat very sugary items and stuff like that. But if you're interested or want to get it for work or somebody else, I encourage you to go to Krispy Kreme and buy a dozen and know that 50% of it's going to go straight to MSA, only MSA charities. So I appreciate you guys. Love you to death. If you like this, share it. I do appreciate the comments. I'm going to try to respond to all your comments. It's been a few weeks. It's been a few weeks, a lot of comments and feedback. My next video will be exactly that. I love you guys to death. And make sure you check out our podcast, the MSA Crusaders, on Spotify, Podbean, YouTube, items like that. And I will see you shortly in the next video. You have a good one. Thank you.